Hello everyone. This is Professor Yamini Bhushan Tripathi, PhD in Biochemistry and former Dean, Faculty of Ayurveda, Institute of Medical Sciences, Banaras University, and Professor in Medicinal Chemistry Department, Institute of Medical Sciences, BHU. As you know that we are interacting in a 12-week certificate course on palliative care with integrative approach. This is a novel idea and which is only possible in Banaras University because in BHU, our founder Pandit Madan Mohan Malviya ji started Ayurveda teaching in 1919 with integration with science, pharmacy and allopathy. You can imagine more than 100 years back, this concept of integration was initiated in BHU, and Institute of Medical Sciences is the only place in the whole world where the Faculty of Modern Medicine, Faculty of Ayurveda are working together under one administrative head. So, coming back to our program, this program of integrative approach was initiated because I realized that at the national level still there is a gap in policymakers to take both systems together, which has already taken place in China. Traditional Chinese medicine and allopathy have been integrated systematically, but not in India. Still there are a big gap between the two systems, and there is no way that one person can do both. It is not possible, and legally it is not accepted. But physicians of two streams can work together if they have a respect for each other. So this course was initiated for the volunteers, for nursing school students, for NGOs, and even for the medical and Ayurvedic graduates. So they can understand the principles of Ayurveda and allopathy, which they are not knowing. And depending on that, they can appreciate their strength. Every system has a strength, USP, unique selling point. What is the USP of Ayurveda? You should know. And if a modern medicine doctor knows this USP, and he compares it with he is not having in allopathy, then only he will have a respect for Ayurveda. Similarly, Ayurvedic graduate should know what is the USP of allopathy. Then only he will. But collaboration is very important. So all the participants who are participating in the certificate course, they are the palliative care giver. The palliative care giver is a part of a team, big team. The team leader is a doctor, allopathy doctor. But members are many. Members are Ayush doctors, members are nurses, members are NGOs, members of philanthropic organizations, members are volunteers like you. So, but nobody is available around the clock with the patients. Only you are available with the patients. So, your responsibility becomes bigger. You have to act as a bridge between the patient and all other stakeholders who are helpful in improving the quality of life of the patients. That's why your responsibility is very high. This course is meant to make you understand how you can act as a bridge, as a good communicator, as a good listener, so that you can appreciate the weaknesses, gaps in the system, and you can fulfill it by involving the subject expert. You are not the subject expert, but you are a bridge between subject expert. Okay, always keep in mind that this is a very important part. So, in the palliative care, our goal is not to treat the disease. because treatment has already been exhausted and the physician has understood that disease is not going to be cured and patient has to live with this disease as long as he is alive. But then quality of life, who will look after? It is you who will look after the dignity, comfort and quality of life. And this is the goal of a palliative care. When a physician realizes that prognosis is not good, he refers the patient to the palliative care unit. And then your role comes. So your role is not to treat the patient. Your role is to treat the symptoms which are making the patient's life bad, discomfort, stressful. That has to be controlled by a palliative caregiver. So, skin care we have discussed in the earlier lecture, mainly the bed sores. Bed sore is a very common wound which is created when a patient is immobilized in the hospital for a long time. But the another problem appears when a stoma is produced in the body to manage the normal physiology of a person by a surgeon. But he has done his job. He has created a stoma. But maintaining the stoma is linked with the skin care. That's why I have taken this topic. So the whole lecture is divided into 2-3 parts. First of all, what is stoma? Why it is created? And what is the function of the stoma? And during the function, how it damages the skin. And if the skin is damaged, what will be the pros and cons in the comfort of the patients? And for the management of pre-stoma skin is another important factor in palliative care. Earlier we have talked about the management of bed sore and pre-bed sore skin. Here we are talking the management of stoma and nearby skin. Both have a different pathology. That's why the treatment is also different. The skin is the same, but the cause of pathogenesis in the skin is different. In Ayurveda it is very clearly said, if you remove the cause of the disease, disease will be automatically cured. But these are the two conditions where you cannot remove the cause. A patient is bedridden, you cannot make him mobile because he is not able. If a stoma is there, you cannot stop you cannot block the stoma. Then what to do? That is the important part. Without removing the cause, how to manage this pathogenesis? Very challenging, but we're going to talk about this. So, with this introduction, I start my talk. First of all, what is stoma? Why stomas are used in palliative care? And importance of skin care in quality of life. I take the last one, the importance of skin care first, then I will come to these two. Skin is one of the largest sense organs. There are 5 sense organs, you know, and all sense organs should be active, then only your life is comfortable. Tongue, nose, eye, ear, all 4 are in your head part. And skin is all over your body. This is a widely spread sense organ of your body. It has a multi-dimensional function, but sense organ, which is a very important part. If the skin is compromised, one of the sense organ is compromised. It's very challenging. So, skin, not only sense organ, it acts many functions. So we will talk on other functions in another chapter. But here I am giving the importance. Nowadays, cosmetology is becoming very popular. Cosmetics. Everywhere cosmetics. It's a big business. But in Ayurveda, also it has been described, but in a different manner. In cosmetology, people are mostly focusing on external applications. They feel putting an ointment, putting oil will improve. But the skin disease is a reflection of a metabolism, internal metabolism. So Ayurveda says that improve the internal metabolism if you want to improve the skin. You see, a different approach, entirely different. We talk about management of whole body metabolism to manage the health of the skin. This I will discuss in this class. And besides that, internal application, internal changes, external application is also important. So, what is stoma? A stoma is a surgically created opening on the abdominal wall that allows the passage of body waste, mainly stool and urine, when normal route of excretion of stool and urine are blocked. Okay? This type is, some examples again, colostomy. When the stoma is in the colon, it is called colostomy. When it is on the ileum, small intestine, it is called ileostomy. When it is the urinary system, it is called urostomy. Stoma means a hole. Creating a hole in your body is stoma. Very simple. So if somebody asks what is stoma, you can say creating a hole in your body. Where it has been created, what for it has been created, that's a different function. But creating a hole is called stoma. One line definition. Why are stoma used in palliative care? Because mostly palliative care patients are cancer patients. And they are diagnosed cancer in the very late stage. And then they go for the conventional treatment like radiotherapy, chemotherapy, surgical interventions, everything. But during that process, cancer does not stop. There is a process called metastasis. It keeps on moving slowly from one organ to another. Suppose I have a cancer in the tongue, I treat it, 90% cells are removed, but still 95% are removed, but still 1-2% are there. They are capable of moving from here to other part, and that is called metastasis. What happens? The patient lives for longer time. After the intervention, after the diagnosis first, and then proper intervention, his life is limited. Maybe from 10 years, 5 years, 2 years, 1 year, and so on. So that quality of life which he is surviving is very tough. So in most of the cases in cancer, if for example the GIT-linked cancer or the urinary system cancer, this is very complicated. So what happens in palliative care, stomas are used to relieve bowel and urine obstruction in advanced cancer stage, to reduce pain and discomfort from the blockade of passage. If you are not allowed to go to the bathroom, how you feel? So stressed, so anxiety. Unless until you go to the bathroom and release your bowel and stool, you cannot work, your mind will not work. Imagine a patient who has a blockage in the intestine, how he will survive. There is a very urgent need to have some surgical intervention so that he can start releasing his waste product and be comfortable. So this is very important. In palliative care, since this is unavoidable, creating a stoma in advanced cancer patients is unavoidable. If it has been created, now then hygiene and ease of care in terminal patients enhance the dignity and quality of life. But once a hole has been created, you are an abnormal person. You feel shy in living, in going to society, in living with your family even. You feel, wow, what kind of personality I have. I am carrying a stool and urine with me while going to my office. You feel so guilty. So that kind of thing has deteriorates your mind stress, quality of mental thoughts, cognitive behavior, everything will be compromised. So our duty is to give him a method of hygiene and ease of care so that his dignity is maintained and provide the swelling and odor. Third important part, the importance of the skin care for quality of life. Proper peristomal skin care. I will tell you what is peristomal. Stoma is the hole and peristomal is the nearby area. It's crucial because skin irritation or infection reduces the comfort and independence. Maintain proper adhesion of stoma appliances. Prevents complications like fungal infection or emotional and social well-being. So why it is important for skin? Because in the pre-stomal area, you see, first of all, I'm diagrammatically, this is the intestine, a cancer patient is there, and this area was cancerous. The surgeon has, oncologist has removed it. On the colon is now cut. So now the stool should pass from here to the anal region. It is not going. It is blocked here. If you don't allow it to come out, it will spread in the body and toxemia will be created and patient will die immediately. The first, because of the infection, septicemia may come. Because the stool is a bad thing. It will not allow good bacteria to grow. It will allow bad bacteria to grow, infection to go. Pus will be created. So we create a colostome. If a small intestine has a cancer area, we cut because it is a very large tube. We cut somewhere. So cutting the distal part of intestine becomes useless. But the proximal part is having all the undigested food. That has to come out. So ileostomy. And this is a urinary system. When the urinary system is blocked, we put a hole here with a urostome. So common types of stoma I have told you. So what is stoma? I have told you this is a hole. And after the hole, there is a skin barrier. This is a barrier cream is put there so that anything which is passing out of the hole should not touch the skin. Once it touches the skin, it may create damage, irritation, infection. So we use a barrier skin. And then paste it on the skin. And on this plate, this is stoma pouch is flanged here. Like this, you see. This is one part, this is the second part. You put this on this. So it becomes like this. So anything which is coming out of this hole is collected here. Then you are hygienic, okay? Your stool or bowel is being collected in a pouch which is airtight. So no smell is coming and you are not, nothing is leaking out, nothing is spoiling your dress material, everything is intact. So this is, but it has a side effect. When you are sticking it on the skin for all the time, 24 hours, what will happen? The skin is never exposed to the air. It is always contaminated with moisture because the adhesive glue has been put on it. What will happen? The health of the skin will be compromised. Blood circulation will be compromised. And that will create a disease. So this is the side effect, okay? Here I am talking the advantage. Flexibility in changing the collection pouch. This is a collection pouch. It is very easy to collect. We need not to touch your skin. We have to take the pouch out and we have to put it again. Convenience, facilitate the easier maintenance and cleanliness. This pouch can be cleaned, go to the bathroom, extract it, and then wash it and again fix it. And customization. Pouches are of different sizes, different type. So you can customize the pouch design, size, depending on the patient and requirement. So stoma pouch details. Two pieces of stoma. This is earlier I showed you, this is two pieces of stoma. One is the adhesive part, one is the collection part. This is two steps. So it consists of a skin barrier, flange and base plate. The base plate I show you, and then pouch that adheres to the skin around the stoma. A detachable pouch that snaps or sticks onto the base plate. You see, this is the base plate and this is a detachable pouch. Collection mechanism. The pouch collects waste directly from the stoma, means the hole, artificially created hole in the body. No tube are required. Why no tube? Because the stoma discharge the waste passively enters into the pouch by gravitational force. Nobody is pushing it out. There is no pump. Since it is open leakage, so whatever is there, by body force it is coming down. Gravitational force is coming down. Tube should increase. If tube is used, it may increase the infection, it may increase the friction, and it may block the natural flow which is coming by the gravity. This is why it is nothing. But in unusual cases, tubes can also be used. That is called catheterization. If this is not possible in some place, then catheterization is also applicable. What is the goal of the stoma care in palliative care? What is the goal? I tell you, skin complications. First of all, it prevents the skin complications. Second, it maintains the hygiene and comfort. You understood? It simplifies the caregiver task. Caregiver, who is the caregiver? Is the family member. First caregiver are the family members. So their job is simplified. He has not to be with the patient for 24 hours. He can visit periodically and help with his patient, because other things are going on by time, naturally. And it promotes the dignity and emotional well-being of the patient. This is the goal of the stoma caregiver care in palliative care. Now, challenges. What are the challenges in stoma and skin care? What are the challenges? The fragile and sensitive skin. The area which is with this adhesive plate is become very fragile and sensitive. And high output or irregular effluent, because the effluent is coming around the clock in this. So that's why there is a chance of leakage. And although we have put a skin barrier, but still, since it is wet all the time and nothing is at 100% proof, it may leak out and it may damage it. Limited mobility and self-care. Limited mobility. If he has a person attaching this, he is not 100% mobile. He has some limitation, where to go, where not to go, when to go. And then he also has a pain, discomfort, and mental distress. The caregiver inexperienced. If the caregiver is not experienced in serving his patients, that is another problem. So all these issues have to be addressed in this pre-stomal. I told you the pre-stomal. You see, this is the stoma hole. This area is the pre-stomal area. Around the hole is called pre-stomal area. You see, pre-stomal area. And that pre-stomal area has different kind of problems. It may have a redness, irritation, or rash. Skin is stripping from the adhesive, because the adhesive is around the clock. So the skin becomes fragile. While you are taking it out, it may, skin also, layer may also come out. And it may have fungal and bacterial infection. And excoriation from leakage. Leakage is, suppose a leakage is there which is not completely blocked by skin barriers, then it will have another problem. So these are some of the diseases I have shown you, like the fungal rashes, redness, irritant dermatitis, or allergic dermatitis. So these are some things which may happen to the patient. Why skin barriers are used? I told you the skin barrier is the first layer after the stoma hole. which is applied to prevent any leakage, not allowing it to touch the skin. It directly should come to the pouch. So function and details. Protection from enzymes and effluent. You know, the body fluid always have some enzymes, lysozymes are there, and they damage your skin also. And this hole is not meant for natural excretion, but we are using it for natural excretion. So a lot of effluent having bacterial component that may also damage the skin. Stoma output, renal faces, contains digestive enzymes and moisture that can irritate or break down the skin. And the skin barrier form a physical shield, but if it fails, then we have a problem. It prevents the moisture-associated skin damage. Skin is not meant for moisture, 24-hour moisture. It should be wiped out. It should be exposed to sun and air for its complete drying. You are taking bath for 10 minutes, that's fine. But once you take bath, you completely dry your body, and then you go to the dressing and other things. So the moisture associated skin damage is very common. This should not be there. That's why, you know, in the summer, when you are having a lot of sweating and you are not changing your dress, there is always a chance of more infection, skin infection in the moist region, in the summer wet region, season. They reduce the maceration, redness, and erosion around the stoma caused by. So if a barrier is there, this moisture-induced damage can be prevented. Improved adhesion and appliances. If by the using skin barrier, the skin will remain intact, which will allow stoma application, pouch and wrapper to adhere better to the skin and preventing leakage. And lastly, it promotes healing. Some barriers are medicated also or infused with healing agents like the zinc oxide, which supports the faster skin recovery. Suppose there is some damage has already occurred because of the moisture or because of the enzyme or because of the bacteria, the healing process may also improve. That's why the skin barriers have a multi-dimensional role. The skin barriers are essential component of peristomal skin care. What is the advantage of using Ayurvedic preparations over allopathic medicine? Now, since the course is of integrative approach, so I am taking you to understand the USP of Ayurveda and USP of allopathy in relation to skin care. What allopathy says, what Ayurveda says. Natural ingredients. In allopathy, this is synthetic drug can contain preservative and alcohol. No natural ingredient is there. But in Ayurvedic preparations, the plant-based and mineral-based agents are used like haridra, turmeric, estri madhu, licorice, grit for preparing the ointment and paste. All are the natural products. And the natural products are more compatible to the body rather than the synthetic products. Multifunctional healing. So in allopathy, mostly one drug for one symptom. So suppose you have an infection, there will be antibiotic. You have an allergy, there will be something else. So suppose 10 symptoms I have showed you in the earlier slide are there. So 10 type of drugs will be added in your management scheme. But in multifunctional healing, over Shotahar offers anti-inflammatory, wound healing, Ropan and Kledhar and anti-exudative action simultaneously. If the Ayurvedic preparations are used, because this is a polyherbal formulation and one herb having more than 100 phytochemicals, so it has a multi-targeted action. So any plant product can be multifunctional. Here, you have to use different kind of ointment and powders for achieving these goals like antifungal, anti-inflammatory. And here, one thing can do many things, multifunctional healing. And biocompatibility, since it's a natural product, the biocompatibility of Ayurvedic products are better tolerated or on sensitive or broken skin. But in some patients may have reactions to adhesive and alcohol-based agents. And immunomodulatory, this is a unique thing which is not present in allopathy. Allopathy is doing only what for they are used. If they are for inflammation, they will do anti-inflammatory, antifungal. But here, the Ayurvedic products are immunomodulatory. Your immune system, your skin has a very strong immune system because the first line of defense is skin. Anything is coming on the skin has to kill it, skin has to remove it. How they will do it? That immunity is very important. So herbs like guruchi and madhuesti modulate the local immunity in the skin, adding healing, which adds to the healing. And allopathy rarely enhances local immunity response. This is the USP of Ayurvedic product. And sustainability, it is eco-friendly, less toxic, and it can be manufactured and used at home. And some agents are petroleum-derived or non-biodegradable in allopathy. And lastly, Ayurvedic preparations may be cost-effective if prepared at home for long-term use, and branded dressings or barriers can be expensive. So the take-home message is it can be prepared at home, a fresh preparation for day-to-day use. And anyway, you are not going to use it on day-to-day purpose because the adhesive patch is not removed every day. It removes after 10 days or 8 days or 15 days, depending on its adhesiveness is maintained. Then you don't allow it to come out. You don't change it. Collection pouch is changed every day, cleaned every day, and then refixed it. So whenever you are changing the adhesive plate, then only the skin care management has to be put in place. Now, mechanism of action. So since I have told you some of these preparations of Ayurvedic preparation, now I am telling you, and I have told you it is a multifunctional. So I am telling you the mechanism. Combined biochemical support. These are the some of the preparations of Ayurveda. It is anti-inflammatory. It inhibits the cytokines response. Fibroblast activation. It activates the fibroblast, which helps in skin healing. If it is damaged, the healing has to be there. So fibroblast activation and angiogenesis stimulation is done by this product. And thirdly, it acts as an antioxidant. Reactive oxygen species inhibition. Free radicals are not good for any cell, tissue, or lipid bilayer, and lipid is present everywhere. So free radical damages the double bonds and triple bonds and make the protein or fat or lipid non-functional. So the free radical damage has to be controlled. That's why the concept of using antioxidant is very common nowadays as a food supplement. But in Ayurveda, every product has an antioxidant. Every product has a flavones, terpenes, and these things are basically have a property to quench the free radical, to absorb the free radical, so that the free radical induced damage can be prevented. So antioxidant property is there in these things. And lastly, moist wound healing principles, occlusion and repair. This is the also USP of Ayurvedic product. Besides the medication, in Ayurveda there is another branch called Panchakarma therapy. A Panchakarma is a special branch of Ayurveda where the Maharshi Charak says that body purification is the first step before you start any treatment. What is body purification? So they have given 5 methods. What is called Vaman, vomiting, Virechan, laxative, Basti, medicated enema, and then Nas, medication by your nose, and lastly the Rakta Moksha, bloodletting from a particular area where the pathogenesis is existing. For example, in eczema, It is a localized patch. So Rakta Mokshan is very good. For example, the osteoarthritis, the blood is, synovial fluid is having full of inflammatory cytokines. This is effective. In many cases, Rakta Mokshan has shown significant therapeutic response. And how it is given? It is given by the leech therapy. Leech is the animal which you put on the skin. It starts sucking your blood. Localized sucking of the blood from the pathogenic area will improve it. So now I am talking in the skin care. So because the skin has been damaged, suppose a fungal infection or something has happened. So now the theory of remove the cause become true here. We are removing the blood from that area which is infected, which is full of cytokines, inflammatory cytokines, full of free radicals. If that is removed, then the healing will be proper. So Rakta Mokshan by leech therapy is also maybe helpful. I don't know when any research has been done on this, but for other diseases, leech therapy has been shown very effective. Now it is our time to test it, leech therapy, in palliative care also. What it happens? You know, there are the different conditions like early irritation, wound stages. Early irritation, inflammatory, ulceration, infection, allergic dermatitis, and hypertrophy. They are the stages of the wound. In skin wound can be at any stage. But when to use? You cannot use leech for everybody, for every stage. I have given you a table, like if it is inflammatory wound, leech therapy is effective. If it is ulceration, leech therapy is effective. And if it is hypertrophic wound is there, leech therapy is effective. What are the symptoms? As a palliative caregiver, you are watching your patients. So how can you know his wound is at which stage? Early irritation means mild redness, burning, and itching. If the patient is complaining these things and you are watching redness, then you can imagine this is early irritation. Leech therapy will not be applicable, and manage with herbal barriers like ointments, which I told you, paste. If it is inflammatory wound like the moderate redness, warm and swelling, and thrombic pain, then you can say it is an inflammatory wound and leech therapy can be applied. It will reduce the local inflammation and pitta rakta vitiation, reduce the pitta and reduce the pain. And if ulceration is there, non-healing raw skin is there, pus is there, discoloration is there, pus is very important, you can watch it by your eye, then use the leech therapy. It improves the microcirculation of the skin, pre-stomal skin I am talking. It detoxifies the wound bed and enhances the granulation. So this is good. But infection, this is not recommended because it may spread other places also. But for here, modern medicine should be used. And for allergic dermatitis also, use anti-allergic because the leech has some kind of hirudin-like enzymes. If already irritation is there, dermatitis is there, then it may enhance it. So don't use this at this time. But hypertrophic, overgrown granulation, moist, warty lesions, then this can be used. So, but remember, for leech therapy or for Ayurvedic therapy, as a palliative caregiver, you have to connect the patient with the Ayurvedic doctor in consultation with your allopathy medical team, because the palliative care team leader is the allopathy doctor. So talk to him, talk to his family, talk to patient, and if all are convinced, then connect the patient to the physician, Ayurvedic physician. He will come and he will decide whether to give leech therapy or not, and if it has to be given, how much it has to be given, how frequently it has to be given. Everything is medically documented in Ayurveda. So now I am coming to this point, how to do stoma care step by step. This is a picturization and this is a written. So I am just first reading it. Gather the supplies because you need gloves, warm water, clothes. Prepare the area. Wash hands, position the patient comfortably, and then remove the unused appliances. Gently peel off the adhesive top to the bottom. Clean the stoma and skin. Use warm water. Pat dry. No soap, no alcohol. Inspect the skin and stoma. Check if there is any redness, any bleeding, any pus of the nearby skin. Apply the skin barrier first. Around the pre-stoma, apply the barrier cream, powder or ring as needed. And then attach the new appliances. Cut to the stoma size, press firmly and without gap. Airtight, without gap, airtight. And dispose of the waste material. Do you see it? This is the stoma with stoma pouch with the garbage. You have taken out. You have drained in your bathroom. Now you have cleaned it, properly cleaning, and then you are putting it again back on the stoma. Now you are ready to work. So examples to modify Ayurvedic barriers powder. Barriers, zinc oxide is the most important allopathic barrier, skin barrier. But in Ayurveda also something can be used, like arrowroot powder, lodra churna, Yashri Madhu, Yashad Bhasma. This is also a zinc oxide preparation. This is called the Bhasma, means mineral product. This is the herbal product. And Haridra, turmeric for healing, antibacterial and healing. And aloe vera, dry gel, fixing agents and barrier enhancer. These are the properties. Aurora moisture absorption. Lodra is the astringent and wound healing. Zinc oxide is skin protectant and anti-inflammatory. Advantage. Fulfills all the three stoma care objectives. What are the objectives? Keep products largely Ayurvedic, biodegradable and skin friendly, and can be positioned as an integrative medical solution. Types of wound as per Sushruti. In Ayurveda, stoma has not been described, but the different kind of wounds have been described. So the Sushruti has recommended the management of different kinds of wound. So some of these wounds are similar to stoma that can be applied. I have just given the example, Varn Mukh, Nadi Vrana, and then fistula, Bhakandar, and this is the Purish face, artificial opening for elimination. So these are the three things which are given in Ayurveda, and in these managements, whatever is given, same thing can be applied for stoma management. So, best practices for skin protection: use ostomy powder or ring for leakage. Avoid aggressive cleaning agent. Change pouch only when it is needed. And secure fit, leakage free. What is ostomy powder? Ostomy powder is a medical grade skin protectant used in stoma care to treat and protect moist or denuded pre-stomal skin. It is beneficial when skin is irritated, weepy, raw or broken down. Its main goals are absorbs moisture, forms a dry surface, and protects healing skin. So advantage of management of supportive stoma care in Ayurveda, no description of stoma, I told you. Wound healing herbs like Jatyadi Tel, Haridra, Gugul, Neem. Digestive regulation. I told you in the beginning that in Ayurveda, everything is linked to your digestive system. And I told you skin is the largest sense organ. It has a very high metabolic rate. So the metabolism will need nutrition. Metabolism will need ATP. Where from it will come? It will come from your general metabolism. For general metabolism means food, type of food, digestion of food, and absorption of food. There are three steps which are taken care for maintaining your good health. Good health of your body, good health of your skin, good health of your any organ, everything depends on your proper digestion. You have to be very careful. The digestive regulation like triphala, pipli, herbal ghee formulations, maintaining it. Anti-infective measures, panchkol, these are some of the Ayurvedic preparations, anti-infective. They are not antibiotic, but they increase the immune system so that the infection may be controlled indirectly. Never confuse that they are antibiotics. They are not antibiotics. They are immune modulators. So this is the method. To support measure in stoma, educate caregiver with simple instruction. Use telehealth to consult with your team leader. Pain control is very important. You can do. And dressing changes you can do. And respect the patient autonomy. So the last, what is I want to say? Prioritize comfort over complex routine. Adjust care plan based on prognosis and respect patient dignity and wishes. To support family and caregiver in palliative care, there are the 6 points I have mentioned. Emotional support and coping strategy, number 1. Number 2, physical care and practical assistance to the patient. Number 3, navigating complex medical information. Number 4, balancing role and responsibilities. Number 5, financial and legal consideration. This is very important. And lastly, promoting self-care for caregiver. Self-care, the caregiver is also under stress while giving care. He should also be made free from any kind of stress. This is the take-home message. So, conclusion, gentle and preventive stoma care improves comfort. Simple and consistent routines can reduce complications. Caregiver support and patient dignity are essential. And combining knowledge of Ayurveda for wound care can be eco-friendly, economically sustainable, and may serve multiple objectives. With these words, I end my class. Thank you very much.